Sepsis is a serious medical condition caused by an overwhelming immune response to infection. It encompasses a broad spectrum of illnesses that range from minor signs and symptoms through to widespread organ dysfunction. The pathophysiology of the condition arises largely due to the response of the host's innate immune system under influence of certain genetic factors. In terms of the epidemiological spread, sepsis ranks in the top 10 causes of deaths in the world. The condition affects approximately 3 in every 1,000 people in the population per year, and there are about 800,000 reported cases of the infection every year in the United States.
It is crucial to diagnose and treat sepsis as soon as possible due to the progressive nature of the infection. Since the discovery of the disease, researchers have worked to identify the most effective ways to assess disease progression and minimize associated morbidity and mortality. Recently, physicians have developed guidelines commonly known as the Sepsis Six, which describe the diagnostic and therapeutic components of sepsis. The Sepsis Six can be divided into 3 diagnostic and 3 therapeutic guidelines, which, if conducted within the first hour of sepsis, can significantly reduce the risk of mortality by up to 50% in patients. The diagnostic criteria include administering blood culture and serum lactate tests and monitoring urine output. The therapeutic components include administering IV antibiotics, IV fluids, and oxygen.
Diagnosing sepsis can be difficult at times because the signs and symptoms of the disease can be associated with other disorders. In order to confirm the underlying diagnosis, physicians can perform a variety of tests such as blood tests and monitor serum lactate levels and urinary output. A blood sample should be drawn from 2 distinct sites to test for infection, clotting factors, abnormal liver function, and impaired oxygen availability. One prevalent symptom of sepsis is a high respiratory rate, which results when the body undergoes anaerobic respiration due to inadequate oxygen utilization. In this case, serum lactate levels are measured as a marker of respiratory distress. Additionally, the urine output, which is a marker for adequate renal perfusion and cardiac output, should also be monitored. Any abnormalities in the urine output should prompt assessment of the adequacy of the circulating blood volume and pressure.
The first antibiotics prescribed for sepsis are broad spectrum, which means that the antibiotics are effective against several strains of bacteria. Because sepsis is classified as a medical emergency, treatment should begin within the first hour of diagnosis to reduce the risk of serious complications. Thus, a wide range of antibiotic coverage is necessary since there is not enough time to find the agent responsible for the infection. IV fluids are also administered alongside antibiotics. Since a drop in blood pressure can occur in sepsis, the body needs additional fluids like saline to maintain the blood pressure so as to prevent dehydration and kidney failure. Vasopressors, which are drugs that increase blood pressure, are also used. The body's oxygen demand can also increase with sepsis. If the blood oxygen level is found to be low upon diagnosis, patients are administered oxygen through a mask, nasal cannula, and, in more serious cases, intubation.
In order to understand sepsis as it's presented in the clinic, it is important to note a few definitions which characterize different types of sepsis. Although sepsis itself is already an infection one would consider severe, there's a term also known as severe sepsis, which refers to having sepsis along with sepsis-induced organ dysfunction. This could complicate matters and make it incredibly difficult to treat. Another type of sepsis is known as septic shock. Septic shock refers to the condition when sepsis itself causes dangerously low blood pressure. The last type of sepsis I'll be talking about here is the systemic inflammation response syndrome, also known as SIRS or SIRS. SIRS is a very serious condition in which the immune system is attempting to fight infection and ends up causing inflammation throughout the body. Taking all of this into account, it's important to understand that sepsis is a complicated condition that requires strict guidelines in the clinic to assess and accurately treat.
For more videos, please like, comment, and subscribe to the Demystifying Medicine channel.